So now we move into the athletic taping component of the course. So I'm hoping now that you have at least a foundational background of anatomical terms, of anatomical movements, and everything from here on out will make a lot more sense. But I think before we can start taping patients, we really have to start thinking about the why to it, right? Because there's a huge inherent reality. Every patient wants to be taped because it looks cool, right? If nothing else. But there's also this other reality that it's extremely expensive practice for athletic trainers. Tape, if you think about it, per box can cost upwards of $32 per box. And there's only 24 rolls in that box. So we want to make sure that we can justify the need to tape. So when we think about why, what we know about tape in general is that historically taping is an important aspect of athletic training. I kind of don't like taping because it's what we've become known for, and it kind of discredits what we do on a day-to-day basis. But with that said, it is a part of who we are as athletic trainers. When athletes think about athletic trainers, we tape and we stretch. But I hope that this program provides for you something much more valuable than the fact that athletic trainers are just tapers and stretchers. We're much more than that. So what we know about taping also is that it is utilized most often to either protect something that's been injured and in some rare cases to prevent certain types of injuries from occurring. Some could make the argument that we use taping, right, to prevent ankle sprains. And so there's a group of researchers that would either agree or disagree with that statement. So I'll let you guys make that clinical judgment. So let's talk about when we tape versus when we actually brace, right? Because I think that's where we have to really, where the rubber meets the road and where we really have to figure out which one do we want to do, because clearly bracing in the short term is probably more expensive, but in the long term, most of us would argue that taping is, right? Because you buy one brace for one patient and that may last them an entire season. Whereas you may tape one patient over an entire season over 100 times, right? So the expense starts to add up. So in terms of tape, when will we actually tape a patient? If we want to compress, like I said, if we want to prevent something, if we want to support a ligament after it's been injured, i.e. in an ankle sprain, or most often in the knee with a medial collateral ligament sprain. If we want to quickly get them back out to sport, so that timing aspect, we can tape them up in 2 minutes. Yes, you will be able to tape an ankle under 2 minutes and get them back out to play ASAP, right? Because that's the goal. That's what our coaches want us to do. But then there are other reasons that we do it, and they're the reasons that I most often use taping. It's to, number one, improve proprioceptive feedback and to improve joint stability. So let's talk about those two, because I think those are the justifications for and the reasons that we would tape an individual. So proprioception, what does that mean, you guys? What it means is the joint's perception of where it is in space, right? So let's think about that. If we have an injured ligament, right? If we have an injured ligament, that ligament is now stretched. So it has lost its ability to really figure out what its role is in that injured joint. So what tape does is it restores that, because it compresses the joint and it tells the joint where it is in space. And we use it until the ligament is capable of providing proprioceptive feedback. So I hope that makes sense. That's probably how I use tape the most. On the opposite end of that, we have bracing, right? And I've said bracing is probably the cheaper option in the long run, most certainly. So when do we use bracing as an option? Well, certainly post-surgically, right? Because that's when the joint is freshest in terms of injury. That's where we need to provide massive amounts of protection. So we can think about, I don't know, an ACL injury, and that patient has just got done with an ACL surgery, and so you'll see them, they're usually stuck in some type of brace, right? Whether that's an extension brace, a DonJoy brace, but they have some type of brace where the goal of that brace is truly protection, right? We want to protect that ligament from being injured, but most importantly, we want to protect that joint that just went through a massive amount of a surgical procedure. And then on the opposite end of that, we use braces a lot to prevent. And I think braces are probably better at preventing injuries than our tape. So when we think about prevention, I'm going to think about D1 football, right? Many of us watch sports. You're going into the field of athletic training, so I'm going to assume you at least pretend to like sports. But as we're looking at those D1 linemen in football, you will notice that 100% of them, maybe 98% of them, are wearing some sort of knee brace. Why? Because what we've seen over in the past is that when linemen didn't wear knee braces, the incidence rate of ACL injuries skyrocketed. And so then, of course, every football team decided that every lineman had to wear knee braces. And it was a good idea because now there was a 50% reduction in the rate of ACL injuries over time. So that's one way that we can use it. The other way that we can use bracing is with chronic injuries. And I'm going to talk about the ankle joint because that's where we see most chronic injuries happen over time. In fact, 73% of patients who sprain their ankle once go on to resprain it multiple times. So it's those patients that come into our clinic that we say, okay, you sprained your ankle once, here's a brace. Wear it the entire season so we can prevent the recurrent ankle sprains that will happen over time. We use braces to limit range of motion, and then I'm gonna put pre-surgery with that. So if we want to limit range of motion, we can lock a brace in a specific position. But most importantly, when we have our meniscus injuries and our ACL injuries, and we have to wait 3 to 4 weeks to get into surgery, we put a brace on to make sure that no more damage can happen in the process. And then last but not least, we can also use a brace to stabilize. So you guys might be asking, okay, so what's the advantages of the two? So let's talk about taping first. What I like about taping is you can customize your tape job to the patient sitting in front of you, right? Whereas a brace, it's a brace. You order it in a size, you put it on the patient, and how it fits, it fits. There's not much we can do about that. With taping, we can maneuver the angles, we can adjust the length of the tape, so it's customizable, and it's one of the reasons that patients love tape the most. It is extremely lightweight, and it takes up very little space, right? Once they take it off, they throw it in the trash. Whereas a brace, they have to put it in their bag, or they have to remember to bring it to the event. So there's disadvantages to the brace that the tape offers and is advantageous for. Its effectiveness has been proven. But what we also know, and I think I'll talk about it in the disadvantages slides, is as our patient begins to sweat, the effectiveness of the tape begins to wear away. So they increase their risk of injury throughout the athletic event. Used where braces are not permitted. So there are some sports, I'll give you an example, swimming is one of them, where a patient may not want to wear a brace to swim, right? We've seen Michael Phelps, who is obviously a world record holder, who used kinesio tape to swim, right? That's water resistance, it's light, it's not as bulky as a brace, and it allowed him to move through his ranges of motion. So tape certainly is permitted in certain areas or sports where braces may not be permitted. And here we go. In the short term of life, it is cheaper. In the long term, it is not. We should definitely be using our braces. In terms of disadvantages of tape, it's expensive in the long term, which I've talked about. It requires your time to apply. So here's my thing, you guys, and I'm probably one of those clinicians whose athletes are like, well, I don't want to go see her. But here's the reality. Just think about taping an entire basketball team, both ankles before practice every single day. If you are good, you are taping a minute and a half per ankle, which means 3 minutes per athlete. If you have 15 athletes on your team, how many minutes a day are you spending on just taping that particular team? That's 45 minutes. I don't know. I value my time, guys. So if we can put those student athletes in a brace, then do it, right? We want them to be as independent as is possible. You need to practice to apply, which is the purpose of this course. And then there is some suggested research that tape over time, its effectiveness will wear away. So you have to be careful. Last but not least, in my first year of being certified, I learned this the hard way. Athletes have allergies. Who would have thought? But who would have thought that an athlete has an allergy to the Tough Skin spray on the skin? Well, that happened to me. I sprayed the Tough Skin, the athlete went to practice, took their tape job off, and literally had hives across the entire ankle joint. So one of the things that is a negative to taping is that the athlete may have it, may have an allergy to the adhesive, may also have an allergy to the tough skin that you are applying. So just be careful. In terms of preparation for taping, there are two key factors that ensure that your tape job is going to be successful. It's going to provide the maximum amount of protection. The first one is to prepare the skin. Some of you might say, well, what does that look like? Well, most importantly, you want the skin to be as free of hair as is possible, right? The guys watching this lecture might say, oh my goodness, does that mean I have to shave? The ideal would be, yeah, we want that surface to be clean of hair, because guess what? As you start to sweat, the hair captures the sweat, which means it makes the tape job a lot looser, a lot quicker, a lot sooner, right? So hair should be removed. So what I had in my clinic was literally a razor, an electric razor, and I would have my athletes shave. And then the biggest thing that you want to do, and the most common reason student athletes would not come back to see you, is if you don't prevent the risk of blisters. So in the taping segment of this lecture, you will see that I applied heel and lace pads or some type of lube to make sure that the tape can glide and slide without causing irritation to the patient's skin. Now, in an ideal world, we would tape to every patient's skin. That is the number one way in which tape should be applied, but there's an inherent reality. It tugs on the skin, it irritates the skin, so most often we'll have to use pre-wrap, which is what you see in the bottom image of the slide. And then last but not least, when you're using pre-wrap, and we'll eventually get to a place to where we're touching it, you'll see that it's very thick, it's foam, so you want to use at the minimal amount of pre-wrap as is possible. So one layer is all you need of the pre-wrap. The role of the pre-wrap is not to provide stability, it's not to protect. The only role is to prevent the tape from irritating the patient. So a very thin layer of pre-wrap and your tape jobs will be a lot more successful. So in terms of taping, I'll mention this a lot in the taping segments, that you want to make sure that you're using the appropriate tape size, right? We have tape that spans 2 inches all the way down to 1.5 inches. You'll learn which size of tape you need to use based on the tape job that you are performing, but then also on the size of your patient, right? If I have an obese patient, let's say a sumo wrestler, and they have huge ankles, I might use a 2-inch roll, right? If I have a very petite patient, I might use a 1-inch roll to tape that ankle. So it's really going to be, remember, very patient dependent. Okay? So in terms of what we're going to do as a class, you all have tape, and what I want you guys to start doing is just getting practice with actually tearing the tape itself. What we know about the best tapers in the world is that they can tear tape seamlessly, without a struggle, without having to put the roll down. So one of the best ways to become better at taping, better with the way that your tape job looks, is to first start with learning how to tear the tape. When you tear the tape, you should have a clear line ready to be torn for the next one. If you have jagged edges or if the tape is ripped, just keep tearing that tape until you finally have a clear-cut line through the tape that you actually ripped.